Hello, my name is Austin Whitted, and I'm a dual degree genetic counseling and public health student at the University of Michigan. And I'm excited to discuss with you my talk today, exploring my public health internship. The title of my talk is Novel Methods for Increasing Engagement Amongst Minority Professionals, an exploration of the Minority Genetic Professionals Network. So this summer I had the opportunity to work with the Minority Genetic Professionals Network, and I'm really excited to share that work with you in this talk. So I have four main objectives during this talk. The first is going to be to present the historical context for a diversity lending network in the realm of genetics. The second is to explore current day implications of this historical context. The third is to discuss the Minority Genetic Professionals Network and current initiatives to increase member engagement, which is where a lot of the work that I did this summer focused on. And the last is to explore the future directions of the Minority Genetic Professionals Network. So going to this first objective, I just want to briefly highlight a few moments in history that have had lasting impact in the field at large. So starting in the 1900s, we began to see this movement of eugenics gaining traction in the US. The word eugenics comes from Greek roots, which essentially means to be well-born or have good genes. For a lot of people, eugenics involved applying different principles of genetics and heredity because they wanted to try to improve the human race. So eugenics was this well-founded movement in the 1900s, and then it gained a lot of traction when the Eugenics Records Office was formed, and the ERO spent a lot of their time building on principles of eugenics, trying to better understand the inheritance of undesirable traits, which they described as things like why people were poor or shorter in height or had particular social behaviors. So from here heading into the 40s and 50s, the eugenics movement loses traction, and we begin to see this transition from eugenics to something that's a little bit more palatable in medical genomics. And so it's important to note here that eugenics continued to move on, but under this new term coined by Sheldon Reed, genetic counseling. Reed would describe genetic counseling as a modern way of carrying on a program eugenics. The term eugenics has fallen by the wayside, and counseling in human genetics has taken its place. So from its inception earlier on, we see that the field of genetics at large was something that was exclusionary, that was supposed to carry on this eugenic belief system for the benefit of society at large. So what does this mean in terms of present day implications from these historical biases? So today there are over 5,000 genetic counselors. However, because of a lot of the historical consequences of in the present day, there's still an issue largely with underrepresentation of racial ethnic minorities, despite a broad acknowledgement of this issue in the field. Specifically, when we look at the professional status survey sent out by the National Society of Genetic Counselors, we see that respondents have consistently answered that they were 90 to 97% of individuals who identified as non-Hispanic white has persisted between that percentage over time, over almost the last 40 years in the field of genetic counseling. This number is a little bit more startling when we compare this diversity in genetic counseling to other health professions. So here I show a table where we see the racial ethnic breakdown of different professions, including physicians, social workers, physician assistants, physical therapists, and more. And what we see specifically is that genetic counselors fail to reach this 5% threshold for Black and Hispanic or Latino individuals that every other field seems to be at or above. And we know that this has a lot of different implications for patients based on what we see in the literature. And we know that diversity in healthcare is very important to the care that patients receive overall. And so there's been a lot of different studies trying to look at this and look at the relationship between providers and how patients trust those providers. And what they've shown is that patients have higher trust and satisfaction when there is a concordance of patient and provider race, language, social characteristics like age or socioeconomic status, and that there's a lot of different factors that patients value in the care that they receive from their providers. But probably even more important to this is that we know that increasing healthcare diversity leads to greater cultural competency-based care and improved health outcomes for minority patients overall. So what does this mean? I think this helps to provide a basis for the Minority Genetic Professionals Network. So from here, we move on to sort of the foundation for why we believe the Minority Genetic Professionals Network is something that is necessary in the field of genetics overall. So a little bit of background, the Minority Genetic Professionals Network, or MGPN, was a project that was started by the Western State Regional Genetics Network, which is one of 7 regional genetics networks across the country. And so what happened was a few years ago, based on literature and some of the data that I highlighted, the individuals at the Western State Regional Genetics Network realized that patients of minority backgrounds would be well served by having more providers with similar backgrounds and perspectives. And so this led to the Minority Genetic Professionals Network officially launching in fall of 2018 with the mission to create a place for racial and ethnic minority medical genetic professionals and those training to enter such professions to connect with one another for the purposes of mutual support and community outreach. So this was in the fall of 2018. And so this organization's still very young. And so that's where a lot of the work that I did this summer came in, trying to better understand who's in the organization and sort of how can we better serve them and better promote engagement and utilization of the network overall. So before MGPN, there was not any formal mechanism in place for students and professionals of racial and ethnic minority backgrounds to connect with each other as a community in this field. So looking broadly at who's in MGPN, we see that individuals in the network report a wide array of racial ethnic backgrounds. However, the most represented racial ethnic background is East Asian individuals with about 80, and this is followed by Southeast Asian individuals with about 77 individuals. So my project seeks to focus on how we can improve engagement in MGPN. So currently there's a lot of ways that individuals can engage with MGPN. The most common way is through the website. This website was initially developed to allow members to register, to have a place to post resources. A lot of different online discussion boards were facilitated here to explore different emerging issues. However, we've recently started trying to transition more of this discussions to a program called Slack. And Slack is a cross-technology app that allows information to be exchanged over someone's desktop or personal devices. Essentially, it's this sort of messaging app that allows for more organic discussion and rapid dispersion of time-sensitive information. And so in Slack, we might see things like members keeping each other up to date about resources for prospective students, asking for research project input, offering emotional support to colleagues and mentees. And we wanted to see if there were ways that we could increase this engagement in the utilization of the Slack platform overall. So how did we do this? We used things like email blasts sent out to the network. We added discussion coordinators to the Slack platform itself, where these individuals were given discussion prompts and encouraged to try to facilitate discussion as much as they could. We started posting different conversation starters, either via email or on different social media. We started utilizing social media, things like Instagram, Facebook, Twitter, to start to drive people towards the Slack platform. We also made some YouTube tutorial videos where we showed people how to use Slack and sort of what Slack could do and how it might serve them and be a useful tool, maybe in addition to using email or social media. And then we also really encourage Zoom events, just a standard Zoom video call with members on the Slack platform so that people could really get to know each other and see each other because everyone is coming from all over the world. So when we tracked this data, we specifically tracked it from June of 2020 through October of this year. And so what we saw was when we stratified by different racial ethnic status, that there were particular events that were very successful in increasing engagement on Slack, and that we were overall very successful in increasing engagement on Slack overall. And so some of these events we highlighted here are in the South Asian group. We saw that when they watch Netflix videos like Never Have I Ever or Indian Matchmaker, that resulted in an increase in involvement on Slack. For the Caucasian group, we saw that there was a drop off actually, and this was because we learned that individuals in this group started communicating outside of the Slack platform itself. We saw an uptick in involvement in the Latinx group, specifically around Hispanic History Month. And then we saw uptick in engagement in different Slack and on those Zoom calls and things like I mentioned earlier in the Black population around things like George Floyd's death in the summer of 2020. So what does this mean? We're really excited to see that what we did worked, that we were able to increase engagement in Slack overall and get people talking and conversing over this platform. So where are we headed? So we're hoping to continue to increase engagement MGPN in a multitude of ways. So I talked a little bit about it, but things like Instagram and posting different posts about different topics that people may be interested in, trying to encourage and promote discussion, maybe around an article or an emerging event. Things like the Zoom calls, being able to encourage people to chat with each other face to face, especially now when a lot of people are struggling with feelings of isolation. And like I said, it's easy to feel isolated in this field as a minority sometimes when there isn't a lot of people that may look like you or be able to relate to your experience. And so that's something that we're really looking into to further promote discussion, and also utilizing Twitter, just because a lot of people are having discussions on this platform across the field. And so we want to continue to explore novel ways to draw people to this platform, but then also try to get them engaged in other platforms like Slack, and also even our mentorship program where individuals are able to seek out a mentor or a mentee, regardless of their status in the profession, whether or not they've been working for 12 years, for 2 years, whether or not they're a student in a genetic counseling program or some other genetics related program, or a prospective student. We're really trying to develop and increase this engagement in this platform because we think that there's a lot of utility and shared experience, and really trying to create a tailored mentorship experience for our network members is something that we think is a large priority moving forward, just to begin to work on how we can and think about how we can continue to move forward the profession at large, while supporting people that are already in the profession. So in terms of future directions, MGPN is continuing to explore novel recruitment methods for high school students. We're trying to increase the number of students that are exposed to careers in genetics early on, and we're really thinking and trying to plan that with members even now, as we know that this is something that differs by region, and even at the point that we reach these students. For instance, we know that we really need to start reaching these students early on in their education, thinking about like middle school, high school, maybe even sooner than those, because a lot of times what we're seeing is that when students enter college, that it's often too late to sway these career decisions. There are also a lot of different research projects that we're exploring, projects that are focused on the efficacy of MGPN. Like I said, this just started in fall of 2018. And so it's important that we continue to evaluate it and develop tools to improve the network, and that we're documenting what we're doing as we move along this process so that we can improve the network experience for all of our members. There's also a lot of different projects that MGPN is working on focused on diversity, equity, and inclusion issues. And this is particularly in focus on with different supervising organizations in the field of genetics. So like the American Board of Genetic Counseling or other accrediting organizations where we're trying to develop ways that we can encourage and promote more culturally competent and non-biased measures for training in different programs at large across the country. Also, we've been exploring the expansion of different subgroups of MGPN, thinking about who else can MGPN serve, who else identifies as a minority subgroup within MGPN. So thinking about people that may have a disability or may have some other identity that they want to meet and get to know other people in the profession that maybe share that same identity. And so we're in conversations about how we can specifically work with these groups to serve their specific needs. But I think a lot of the future directions of MGPN is to be determined, because MGPN is something that's very organic. Like I said, even in the data that I showed you, some of the engagement that we've seen and the increase in Slack and across these other social media platforms are things that really just happen naturally. People asking to schedule a Zoom call with other members, or asking to watch a movie together online, and really just we try to take advantage of different opportunities and needs that the members share as they arise, because we think that that's when MGPN is functioning at its best, when members are able to support each other and empower each other to collaborate on different projects in a timely fashion as things arise. And so this is something that we're really excited to continue to look forward to overall, and how this continues to develop in the field. And so with that, I close, and I want to acknowledge my internship preceptors, the project collaborators on collecting the Slack data, and then the Western Region Public Health Training Center for their funding and support, and then the Western State Regional Genetics Network and the University of Michigan School of Public Health for the opportunity to pursue this internship. Thank you.